I had to be convinced to come over. It's like, okay, I need to go to the doctor, but it doesn't feel like I'm going to the doctor.
Amy couldn't have been sweeter, kinder, more honest about, okay, we're gonna get through this. It just feels like home without home, if that makes any sense.
You and Amy are doing such a brilliant job of stripping away all of the fluff and getting down to, if you do these core things over time, 80% of the time, you will live longer, healthier, and better. And isn't that the goal that we're all searching for?
If you have weight coat syndrome, you won't have it here. You know, you're not another number in a patient chart. You know, she knows your name. The callbacks that you get are from Amy. They're not from the nurse or an assistant or an assistant's assistant or, you know, something like that. So it's just very personal care, and it works.
You guys took the time to figure out what had been going wrong. My visits with regular medicine, I was just a number, and 12 minutes and you're out the door. So I'm glad I came in here by referral to figure out what's really going wrong in my body and how do we fix it.
Hey everybody, welcome to another podcast. We're so excited to get this going because we are right at a year of doing this, and we're celebrating this month of August. And so this is a podcast on celebrating the benefits that we've added to the patients. And we thought that this podcast could be a lot about how this vision is integrating into and transforming people into healthier people. Mm-hmm. And so we wanted to kind of highlight that a little bit. Starting with this vision, Amy, obviously this is all about, medical support and helping people to live this high quality, optimal life. How does this work? How are you doing this?
You and I always had this vision to be able to merge our wellness center, our idea of helping people on a path of optimal aging and just health versus dealing with treating sick people, right? And merging into my family medicine practice. Oh my God,
I just thought of this when you were saying that. Back in 2006 when Dad grabbed us and said, you're going to integrate these things. Isn't that funny? Yeah. It's not funny, but it's kind of interesting to see how it works.
Yeah, it's pretty neat. So, you and your mom and I started that wellness center, and we moved from Muncie here, and I started a practice. But I think we always wanted us to be in one roof and really to make that model what healthcare is. And then I heard about the term direct primary care, which I think we were going to spend a little bit of time explaining that. But that direct primary care model was the perfect model to be able to do this and to say, okay, we're going to...
It's like your foundation when you were trying to think of how does this work? And I know you did all kinds of research for, this has been years in the making, right? Before we really kicked this thing off. But what intrigued you about that?
A lot of people hear about something called concierge medicine, and this is similar, but it is unique. It's different. And there's actually the term direct primary care, which it evolved around 2007, but Harrison Bliss is, I love that name.
Dr. Bliss. We did not
Dr.
forget
Bliss.
That name after we forgot it a couple of times. Yeah, how can you forget that?
I know. He actually is quoted to be kind of the father of this whole concept. And I think it was like 1997 when he decided he wanted to change his practice and really kind of step outside of the insurance model. And what he said is his goal was to establish a practice that would provide quality care at a predetermined cost so patients know what to expect, because obviously there are so many hidden costs in the healthcare system. And he also wanted to have a smaller panel and have more personalized care. And so that was kind of the birth of this whole model of direct primary care. I love it. He said, cultivate a culture of care and service versus a business model. And unfortunately, we all know healthcare has definitely become a business, right? And that's very pervading in a lot of the avenues of healthcare today. Don't need to have a bunch of sick patients or sick patients to make the model work. And then he said we wanted to stop rewarding overtreatment, overdiagnosis, overevaluation, and overpricing, which goes back to this whole fee-for-service model, which right now that's how the healthcare system works, right? You get paid when you see a patient, and usually that's a sick patient.
It's moving away from that, but it's moving at a very slow pace, right?
Yeah,
You just
so-
jumped out and said, let's just get it going, right? That was 2 years ago, 3 years ago, maybe. And you were like, I want to get closer to my patients. How do you do that? And you get rid of the insurance company and the health system so that it's just the doctor and the patient working together. I loved it when you said that right out of the gate. And the direct primary care model was, your
the
initial
great-
foundation. You're like, here it is. Here's the model that we can build off of.
And there are a lot of practices. I mean, this is a growing trend. I think there's 1,600 practices now in the country in 48 states. When you look at
300,000 patients, and
are
our
cared
patients
for.
are just the beginning edge. Look at that.
right.
They're just right there at that cutting edge of
Yeah.
what this is going to look like in the future. We love to say this is true healthcare in the future.
Yeah, and I think what we did, as you mentioned, we kind of stepped beyond, because a typical direct primary care practice, patients pay a membership fee per month, right? So it's a monthly membership, and then you get your annual physical and any type of acute care, direct access, same day, next day appointments. It's a small panel, so you directly basically talk with your doctor or, the nurse or the staff or you. We went a step beyond, and we build in this whole coaching, and we call it holistic primary care.
Because we had
So
our
that's-
wellness center since 07.
Yeah, and
You
so
know,
we've
let's
integrated that
integrate
with
these
our four
together.
pillars: the breathe, eat, move, sleep.
And you're calling that holistic primary care.
I am calling that
It's a-
holistic primary care.
A little different. It's unique.
Yeah, and we do touch bases every 4 months, which is also unique. And those are your wellness checks. And then we come up with a personalized plan, a health focus, and the patients then, take that 4 months to work on whatever their health focus is. And that's using you as a coach to really help integrate that plan.
Which means instead of just giving them a printout and saying, here's your lifestyle recommendations, go do them.
Right.
Right? I get to call them up and chat with them and say, what does this mean? And what of all these things that Amy wants you to do from a lifestyle change that's going to positively impact your life, move you in the direction of optimal living, do you want to work on today? Right? And then we usually work on it for a month or two, and then we check in again until it's time for you to meet with them.
And I think that accountability factor, I mean, we all need it. It's hard. Life is, they leave our office and they have jobs and they have families and, things happen. And so I think it's just so great that they do have that accountability factor. But also we've built in so many different modules and patient education materials, from YouTube videos to workout videos, recipes, cooking videos. And it just depends. Everybody's focus and health plan is different. And we have all the range of ages from newborn to in their 90s. And so everybody's have their own goals and health focus. And it's really, again, focusing on optimal aging, optimal health, optimal functioning of our body, instead of just reactive care and sick care and dealing with disease and a pill for every ill.
I think the one thing that does excite me is we're building the knowledge of the patients that we have on board. And so whether it be them working with you and you're building medical knowledge on, hey, here's this, and this is a condition, or these are your symptoms. Let's try to figure out what exactly is going on with you. And then when you do, then you're like, these are the things out of your almost 30 years as a doctor that I know can kind of help move you out of where you're at into a better place. And then I do the same thing on the coaching piece with the lifestyle, right? And then you've coined it breathe, eat, move, sleep, where breathe is really stress. As Americans, I mean, I think everybody in the world probably has stress to some level. And my job is to build their knowledge across those 4 pillars and then give them an experience that says, when I do this way, I feel this way. And when I do that, then I feel that way. And I want to feel this way. Right. And so now there's an empowerment element for change based off of knowledge and an experience. And then it's just been interesting to watch, right, how that works for people. Some people just, I tell them what to do and they go do it. That's a very few, just like a handful of people. But every time when they implement stuff, it creates change. I mean, positive change, right? And then others might say, Eric, I haven't done anything since the last time we talked. I was like, that's fine. I mean, right? That's what happens. And here we are a year later, but a lot of people are like, I'm glad you stayed with me over this year because now I'm in a different place. Where the first couple times they'd be like, I didn't do anything. Eric, okay, well, fine. What's going on? You're right. I mean, so we talk about life stuff and how to then create a tiny little experience of positive change, right? And so there's some really, I think, fun things that we're able to do together. You said RAD, right, is reliable, available, and doable, and we do make things doable for people. So
I think just being on this journey together as well. Every week we have our weekly breath, and it's just so sometimes it is literally doing a 2-minute
which is a
breath
video
together.
for those that don't know. It's
a
our weekly video to people.
Weekly video, and it's like an email too that we throw in health tips and healthy living. And each week of the month we go over one of our pillars. So we do the breathe, eat, move, sleep each week. And I think just that alone, it's like this, being there together, gentle reminders, little pearls that help this be more doable, this healthy living. And so I think that also, because I noticed, in my old world, in my old practice, people would be nervous to come to the doctor. They would dread
the white
it.
coat syndrome.
And then they would
real, isn't it?
feel like they had failed, or I saw you a year ago or 6 months ago, and then I didn't get my cholesterol down, or I didn't make any changes, or I did well for a couple months, and then here I am again. And that's the thing. It's like, I think these frequent touch bases as well make such a difference in helping people just, again, stay on this path. And I mean, we all veer off, but it's like, okay, come on back in. And it gets easier and easier the more you practice.
The one thing that does intrigue me, and of course, we talked initially about you moving from the traditional medicine model, medical model, into this direct primary care model, and then into this holistic primary care model, which makes us kind of niche-y, a little unique. That people from that are able to, your point, over time realize a real change, right? I mean, that they're at a point where they are experiencing it, seeing it, living it, and it takes more time than what they originally thought, right? And so I think that's the other thing that makes us a bit unique, is that we are kind of with people through the life changes that ultimately are going to create that positive impact. What are some other examples that you've seen on the medical side in a short period of time that maybe would have been difficult in just traditional medicine?
I think a good way to go through this is looking at, again, I think the direct primary care model has really allowed us to do this, to serve patients in a way that I knew I wanted to, but there were so many hurdles and things beyond my control that I couldn't do in my prior practice. And there are 5 key tenets that they talk about, and it's number 1 is service, number 2 is patient choice, 3, elimination of fee-for-service, 4, advocacy, and 5, stewardship. So I thought I'd maybe kind of go through each of these a little, because I think when I discovered this model, I realized, I've been doing this to some extent, this direct primary care model, but I had, over 2,500 patients, probably pushing 3,000, and I was burning myself out because I was trying to be there and be this direct primary care doctor in the traditional model, and it was just not sustainable.
Right.
So number one, service. One of the big hallmarks of this direct primary care model is adequate time spent between the patient and the physician. I love this. It said, unfettered access to care, unhurried interactions, frequent discussions to assess lifestyle choices and treatment decisions aimed at long-term health and well-being. And I think that the time factor for both me and patients has been life-altering for both of us. It's helped me with my just my own ability to dive in and give better care, have time to research. I see every patient at least an hour. Sometimes it's an hour and a half. And follow-ups are at least 30 minutes. And so, having time to spend with the patients, and then afterward, I also have more time because in a day, I maybe see 5, at a busy day, 10 people. In a busy day, I may see 10, but on average, 5 or 6 patients in a day. So I have so much more time, even in between patients, to research and really advocate for the patients. And I have a lot more time to squeeze patients in when they need to be seen. But I think that the time factor is phenomenal. Patients don't feel rushed. They have more than 10 minutes to go over their issues. And you know what? I learned so much more. I have patients that followed me that, there were so many factors in their life or their history that I didn't even know because I never had time to learn. And so now I understand their likes and dislikes and their challenges and their history and their family history and their genetics. And so it's really amazing. Number 2, when it mentions patient choice, patients are fully involved in making their own medical and financial choices and have the right to transparent pricing, access, and availability. And I think that's the big thing too. Everybody's got these big high deductibles right now. It's just the way medicine is. And so we have upfront, every month, this is your bill, and then you can come and see us and talk to us, and there's no hidden prices.
We don't have a sign that says "See cashier" on the way
right,
out.
Right.
There is no exchange.
No
ever.
Further exchange of money unless they buy
unless
like
they're
a
buying
supplement or.
Yeah.
And I think also we really spend time helping them look at prices of imaging and labs and shop around, and that's been really enlightening to people too.
It's definitely at the end of on the pricing piece at the end of a year, and we've brought on hundreds of people. I think there's only been like 3 people that have actually left in a whole year. So it's a good pricing, obviously.
And I mean, we're busy. We have a waiting list.
Right.
So I think, this whole model, there are direct primary care physicians. Maybe not all of them are doing the holistic primary care, but there are direct primary care physicians, like I said, in 48 states, and there's something dpcfrontier.com, I believe. And you can search your state or your city and find physicians that are following this same type of model and philosophy.
And our next podcast after this one, in a couple of weeks or so, is going to be focused on the benefits to the provider and how. So we're going to dive into that a little bit more too.
Number 3, they mention elimination of fee-for-service. These incentives distort healthcare decision-making by rewarding volume over value. And that is so true. In the old model, in this fee-for-service model, you get paid every time you see a patient in the office, right? And so the more you see, the more you pay. The sicker the patient is, the more you get paid. So, it's just, again, eliminating that. And it takes away that hurdle of people being hesitant to come in because they don't want to pay an extra copay. People, not having time. Well, we do a lot of phone visits and follow-ups. It's wonderful. Or video visits. You do your coaching video and Zoom. So people don't have to leave work, take off work, lose money, be inconvenienced. So that's
and one
amazing.
clarification on the fee-for-service, the new term is value-based contracting, and this is driven by our government, Centers for Medicare and Medicaid Services. They've been trying to do this, even some of the other insurance companies, for, 4 or 5 years now. And it's moving in a very slow direction. Mm-hmm. So the beauty of this is you left that model open to practice, and a year later, the impact you've had with patients is unbelievable. And the rate at which it's the current healthcare system is moving into value-based contracting, it will probably be another 20 years before they even, at the rate at which they're going, even get
To try to
close
get
to
away
what
from
we're
fees
doing
for
right
service.
now in 1 year. Well, less than a year. Immediately, we did it.
Another DPC providers are committed advocates. They have time to make informed, appropriate referrals and support patient needs. And, that is so true. I have time to even call specialists. I mean, I have numerous examples of I had a patient who had an ankle sprain and then it wasn't healing. We had to do imaging, actually showed something called an avulsion fracture. So the tendon pulled a little piece of bone off. And so I was really worried. I was like, I don't know if this needs to be seen by an ortho. Called the ortho over the phone. The ortho looked at the images, said, nope, you just keep doing what you're doing, keep them in the boot. I saved the patient a referral and money. It's just been numerous times. I mean, I have a lot of physicians too that let me maybe text a picture of a mole or, whatever, a rash. And so it's just awesome that, we have time. Before I didn't have time. And I feel like, I do less referrals. In the fee-for-service world, you're so busy. If you're seeing 20 to 50 or 60 people, you don't have time in that 10 or 15 minutes to manage hardly anything. So what do? You refer them all to different specialists. So many patients have 4 or 5 different specialists, which in a normal world, primary care should be able to manage 85 to 90% we're trained to manage 85 to 90% of medical conditions, but that doesn't happen. The last tenet is stewardship. And I love this because direct primary care providers believe that healthcare must provide more value to the patient and the system. The ultimate goal is health and well-being, not simply the treatment of disease. And, our medical model and our medical system's awesome for acute care and hospital care. And I mean, we do an amazing job, but we're just so focused on diagnose and treat disease, right? A pill for every ill, instead of standing back like we talk about and really focusing in on health care. That's why I went into medicine. I wanted to help people stay healthy. And so now I get to do that with this model, and it's been phenomenal, just the journey and the testimonies and just watching people. It's not just been medical diseases we've helped them with. We've helped them emotionally, and so it's been amazing.
Yeah,
Don't you
no,
agree?
I agree. And so we're excited about all the benefits for the patients and this opportunity to afford this to the ones we have on board, and hopefully a lot more down the road as well. So we hope you gained a lot from this, guys. Wishing you a wonderful day. Take care.